And I want to throw some numbers at you, and we're going to talk about the 3 top leading causes of death in this country. May surprise you. Here's some numbers for you. The cost of treating heart disease in this country a year, and these are numbers that go back a couple years because they don't have the latest numbers, is $219 billion for heart disease. $219 billion. And that's for the services, medication, and premature death. It's $209 billion for cancer treatment. Okay, that's for the cure of cancer, drugs, and all this other stuff. And they're projecting that cancer within the next 30 years is going to cost the world. Cancer in the next 30 years is going to cost the world $25 trillion. In the next 30 years. Diabetes, which is not listed as your top 3 killers of Americans, actually is. And that costs our country $412 billion a year. So you can see it's almost twice that of cancer and heart disease. Now, when you add those numbers up, you're looking at close to $1 trillion a year. So there's no motivation to talk about how people can prevent, and that means not get, these diseases. And the information that's given to us is so confusing. I mean, even in my research, I'm pulling up stuff and I go, this is a bunch of bull. On diet, cancer, heart disease, and diabetes. Because you can get 2 different really high, high universities that will contradict each other. And you go, well, what do you believe? And there's always a political agenda based on the information that they disseminate to us, get to us. The mainstream media and the woke part of our country want you to be vegetarians. They don't want you to eat any animal-based anything. But the research that I read and I dig up contradicts that. I've got one right in front of my face. This is from Penn Medicine News. Not out that long ago. Keto, that's fat, molecule may be useful in preventing and treating colorectal cancer. Penn study suggests. It says a molecule in the liver in response to a low-carb diet has a powerful effect in suppressing colorectal tumor growth and may be useful as preventative in treatment of such cancers, according to a new study from researchers at Perelman School of Medicine at the University of Pennsylvania. In the study published in Nature, researchers initially found that mice on a low-carb, high-fat ketogenic diet have a striking resistance to colorectal tumor development and growth. The scientists then traced this effect to what's called beta-hydroxybutyrate, a small molecule, organic molecule, produced in the liver in response to a keto diet or starvation. Our findings suggest that this natural molecule, BHP, could someday become a standard part of colorectal cancer care and prevention. Says study co-senior author Mayan Levy, PhD, an assistant professor of microbiology at Penn Medicine, whose laboratory collaborated with the lab of Christoph Thies, PhD, also an associate professor of microbiology. The study's first author, it was a doctor or PhD, Picasco, a postdoctoral researcher at Levi Lab. Colorectal cancer is one of the most common cancer types and kills more than 50,000 Americans annually, making it the country's 3rd leading cause of cancer mortality. Alcohol use and obesity, and here he goes to red meat, and low fiber and high sugar diets have all been linked to greater colorectal cancer. So anyhow, it's the ketones, it goes on to say in this article, that it's the ketones that are produced by the body when you're on a low-carb diet that fight off cancer cells. And it's the low-carb diet that takes on inflammation. And so you use this and you compare this to the other diseases that I just cited. Heart disease is another one. And diabetes is another one. That eating like this helps in the prevention, that means don't get, of these diseases and treatment if you do have it. But yet I guarantee that these topics were never brought up to you by your doctor who's caring for you. Give you an example. Most of my listeners do not know, the new listeners, that I had a bad infection about 5 years ago, this coming June. A viral infection that attacked my heart. Yeah. Viral infection that attacked my heart and caused heart failure. They call it infectious or viral cardiomyopathy. My heart's pumping capacity was only at 10%. Of course, at that point, the recommendation was, either heart transplant or I'm going to die. I'm serious. I'm not making this up. And I spent 10 days in a local hospital, one of the best cardiovascular hospitals supposedly in the country. I get blood was taken from me about every 3 hours, and they kept commenting how good my blood work looked because I didn't match their cookie cutter patient who comes into the cardiovascular ward of a hospital. Here's this fit man with tremendous blood work having heart failure caused by an infection. But it's that same fit man who the doctors claimed this is what saved my life because of my fitness levels, my health level. I was literally a healthy, sick man. Seriously. I'm not making this up. They kept scratching their head. Can't figure this out. It's a virus. Okay, my immune system got compromised somehow, and I got sick, but I came through it. I always say that, it might be this fit guy, but it was my faith in God to believe that God wouldn't put me in this position to be sick like this without a defense, and the defense is my health. Literally, seriously, my lifestyle that I've been on for a long, long time. So I've been on this type of diet now for a long time. Let me share these numbers with you real briefly. My glucose is 79. Total cholesterol 193, triglycerides 34, HDL, the good cholesterol, 85. You don't see numbers like this with people taking statin drugs or other medications. It's called lifestyle. So we know that this type of eating is so effective in so many different conditions. But when I threw these numbers out at you, nearly $1 trillion for 3 diseases yearly to treat them, there's no motivation for Big Pharma to get you off the medications or give you the information. They want to use the media to steer you in the wrong direction to keep eating the same junk we've been sticking in our faces for a long, long time now. Same junk. And of course, the way our country works in regards to fitness for people in our age group, because I'm 68, I'll be 69 here in a couple of months. Gyms are not set up for people like us. And I won Mr. Universe twice. I don't feel good going in a local gym. I feel intimidated by the environment. Literally. Intimidated. Got all these people running around, young people. Some of them hitting on the others trying to get a date. Or if they're not doing that, they're sitting on a bench with their AirPods in their ears, listening to music or whatever, listening to, not paying attention to what's going around them. Taking and tying up equipment. That's not conducive for fitness. And it's sure not inviting for you and me. They're not set up like that. The local fitness centers are set up to make money, and making money means you not showing up. Remember that. Remember that. That's their MO. That's their business model. I guarantee you that. I used to be in that business 30 some odd years ago, and I can tell you that's their business model. Join, don't go. I'm telling you. That's why prices to join fitness centers are so enticing. They're cheap. And of course, they figured out a way of keeping people paying by doing this electronic transfer of funds out of your banking account or your credit card every month. Because by the time you stop it, they made a lot of money off you. The number here at the studio is 602-260-5394, just in case you have a comment. So we're talking about 3 diseases that cost nearly $1 trillion, all tied to lifestyle primarily. So you want to prevent these things from happening, and that's called what you eat and what you do. The diet you're on and the fitness exercise program you're following on a consistent basis, religiously, 2 to 3 days a week. You don't have to exercise every day if you do the right things. It's nice, but you don't have to. You know, my experience, because I have a firsthand experience in a cardiovascular ward of one of the top heart hospitals in the country, is they feed these people the wrong way. Yes. They put them, just look at their menu, the heart menu. It's loaded with carbohydrates. And most of these people that are in that part of the hospital, they're already pre-diabetics, if not diabetics already. And to give them more carbohydrates and they're laying around in the bed just feeds the sickness. It doesn't help it. I've got an article in front of me right here, Keto Diet for Heart Failure, What Clinicians, Patients Need to Know. It's a new review. It explores why it could work and what precautions to take and many unknowns left to address. When I was in there, my wife and my kids were bringing my food. I said, I'm not eating this stuff. I had a discussion with the nutritionist in the hospital. You know more about this than we do. Word is spreading among patients with heart failure because that's a rising problem in this country, but they're not, most of them don't have infectious. Okay, the heart fails because of being obese, high blood sugar, and high blood pressure. I didn't fit that mode. Word is spreading among patients with heart failure that going on a ketogenic diet could aid their health, even though the evidence supporting benefit over risk is still in the early stages. A new review article recently published online in JACC Heart Failure is making the case that heart failure specialists should be aware of what the literature does and doesn't say and be prepared to guide their patients along the way if they choose to pursue this path. Choose to pursue? There are some scientific underpinnings behind the idea that ketogenic diet was originally created to treat epilepsy, but now seen by many as a tool for weight loss and glycemic control, could be beneficial in heart failure. Now listen to this. The failing heart increases oxidation of ketone bodies, that's fat, to meet its energy demands. So it's conceivable that the ketogenic diet could aid the failing heart by boosting the supply of ketone bodies. However, the ketogenic diet could ameliorate, heart failure by improving overall metabolic health, including body weight, lipid profile, glycemic control, and blood pressure, the paper notes. It goes on to say patients and physicians alike really kind of recognize some of these evolving concepts. Okay, and goes on to say how this is tremendous. It says some data suggests that eating patterns can both increase LDL cholesterol and adverse cardiovascular events. That is not true. I'm proof in the pudding. This is how they scare people away. It can bring your LDL up. Let me tell you what controls LDL. Insulin does that. Yes. Insulin tells the liver to make cholesterol. Did you know that? And the use of statin drugs block in the metabolic pathway in the liver to tell the liver to make cholesterol and fat. That's why statin drugs increase your risk of developing diabetes, and if you have it, progression of the disease. That is the truth. So if you go on a low-carb diet and you're providing ketones for the heart to function, it makes it work better, not work overtime. Work is hard. Increasing the outcome. But when you look at the cost of medications to treat this disease, it's incredibly expensive. You know, when you see TV, and when I get up early, you watch television in the morning, they always have a commercial for heart failure for Entresto. That drug is extremely expensive. Out of pocket could cost people in the area of over $2,000 a month. Yes. I'm not saying it's going to eliminate the use of these medications. What I'm saying, it can cut the need for them way down so you need less of it. And the other drugs that are tied with treating heart disease and cancer and other sicknesses and diabetes. But they're not going to give that out to you, particularly when 3 diseases alone cause of death nearly come up to $1 trillion in treatment costs a year. $1 trillion for 3? They're not. There's no company on this earth going to tell you how not to take their product. None. It'd put them out of business. Think about that now. The thing is to get you to take more of what they have. Good example is this Ozempic kick. Everybody and brother running to get Ozempic because they don't stick on a diet. I need this help. I need this help. Only to get on that medication and have all kinds of side effects. Gastroparesis, increased risk of thyroid cancer, pancreatitis, all kinds of stuff. Muscle pain. And once you come off it, you gain the weight back. You can't stay on it forever. Big bucks. They make the money. And then you see the stuff like this I've got right in front of me from Cornell University, Cornell Medicine, Sandra and Edwin Mayer Cancer Center. Old idea survived, starved cancer to death. Listen to this. This was in the New York Times. The story of modern cancer research begins somewhat improbably with the sea urchin. In the first decade of the 20th century, the German biologist Theodor Baveri discovered that if he fertilized sea urchin eggs with 2 sperms rather than 1, some of the cells would end up with the wrong number of chromosomes and fail to develop properly. It was the era before modern genetics, but Baveri was aware that cancer cells, like the deformed sea urchin cells, had abnormal chromosomes. Whatever caused cancer, he surmised, has something to do with chromosomes. Today, Baveri is celebrated for discovering the origins of cancer. But another scientist, German, Otto Warburg, was studying sea urchin eggs around the same time as Baveri. His research, too, was hailed as a major breakthrough in understanding cancer. But in the following decades, Warburg's discovery would largely disappear from the cancer narrative. His contribution was considered as negligible that they were left out of textbooks altogether. Unlike Bavaria, Warburg wasn't interested in the chromosomes of sea urchin eggs. Rather, Warburg was focused on energy, specifically how the eggs fueled their growth. By this time, Warburg turned his attention from sea urchins to the cell of rat tumors. In 1923, he knew that sea urchin eggs increase their oxygen consumption significantly as they grow. So he expected to see the same need for oxygen in the rat tumor. Instead, the cancer cells fueled by growth by swallowing up enormous amounts of glucose, blood sugar, and breaking it down without oxygen. The result made no sense. Oxygen-fueled reactions are a much more efficient way of turning food into energy, and there was plenty of oxygen available for the cancer cells to use. But when Warburg tested tumor cells, including one from humans, he saw the same every time. The cancer cells were ravenous for glucose. Do you realize that cancer cells use about 200 times more glucose than normal cells? 200 times more. That's where the PET scan comes from. So if it's using glucose, doesn't it make sense, like this article would say, starve cancer to death? It would make sense. That should be part of your treatment plan, is low-carb eating, keto. All right. Let's go to the phones. Let's go to Keith from New River. Hi, Keith. How are you? Hello?
Yes, sir.
Yes. Hi, Keith.
Hi. Am I on the air?
You sure are. Go ahead.
Oh, hi. Okay. 57-year-old. I thought I was pretty healthy. My cholesterol since I was 17 has always been around 225.
Okay.
I went up a little bit. I got on those statins for, I think, 6 months. It didn't change my numbers enough at all for the doctor to think I still needed it. Long story short, just normal blood work was done. I found out I have 2 blocked arteries, so I'm going in for an angiogram on the 21st, and they said it could mean bypass surgery if they're 2 blocked. So what does a guy like me do from here on out when I think I'm already eating really healthy and getting good exercise?
Okay, how long have you been on statins for?
I only was on them for about 5-6 months, and I pulled off because it didn't change the numbers.
Okay, and how blocked are the arteries?
The test showed 70 to 90%.
Most likely they'll put a stent in.
Right.
Okay, they don't like to do bypass anymore. The stents work actually pretty good. Okay, but you need, first off, what was your HDL, the good cholesterol? Do you know?
I don't. I don't have those numbers in front of me.
Because you're 57. Here's what I tell my listeners. Know your numbers. Okay, because then you know what you're dealing with. Because just saying 225 total cholesterol, the cholesterol panel is made up of LDL, and there's two types. You have the soft buoyant particles, okay, are large, and the small tight particles, which are oxidized. Those are the ones that are not good. They adhere to the artery wall, and I'll tell you why in a second here, okay? So the HDL, LDL, and what we call very low density lipoprotein, which come from triglycerides. Those three make up the total cholesterol panel. The LDL is commonly referred to as the bad stuff. It's not bad if it's buoyant and big. HDL sweeps away the LDL, brings it back to be basically recycled again in the liver. Okay, and the VLDL actually is what you make LDL from, and that's tied to the inflammatory markers, which are tied to heart disease, because inflammation causes the arteries to become inflamed. This is what causes the cracks that form, the lesions that form in the arteries. Then the body goes in the repair process of plaster and piercing that crack. Just like if you had a crack in your stucco wall, you're going to put plaster on it, right? Stucco to fix the crack. The same thing happens in the arteries. In your case, it keep building more plaque in there because that crack keeps forming. Right. Now, 7 out of 10 heart attacks don't occur in a kind of a plaque that you have. They occur in what we call vulnerable plaque, where the plaque actually, where the artery is wearing away into the wall, like a rusted pipe.
Okay.
Okay, and the plaque buildup is a real small scab on the outside, and is vulnerable. Basically, blood pressure will cause that plaque to break loose, and the blood clot forms to keep you from bleeding, and you have a heart attack. All right? So from here on in, tell me what your definition of a good diet is.
Never sodas, never sweets, candies, cookies, cakes, stuff like that. We eat very little red meat, fish, and my downfall, I guess, would be more pasta than probably I should have. But
there we go.
Fruits, vegetables every day, and then all the normal average types of vitamins for
Yeah. Okay, what do you have for breakfast normally?
Either oatmeal or a bowl of Cheerios is 90% of my.
There we go. That's all carbohydrates. Well, I was in the grocery store the other day and I see an advertisement, actually a box of Honey Nut Cheerios with the heart symbol on it. Very misleading. Okay, because these carbohydrates, whether they come from a starch or a plain sugar, increase blood glucose, which then we have the insulin effect, which causes all these problems. Okay, causes inflammation. So breakfast is on the wrong foot. You heard my numbers from earlier, right? My cholesterol and whatnot?
No, I actually just turned in.
Okay, my total cholesterol, this is without medications, is 193. My HDL, that's the good stuff, is 85. My triglycerides are 34. My blood sugar is 79. All right, this is without statins, and I'm almost 69 years of age. All right, but here's what I have. Here's my daily diet, Keith. For breakfast, I have 4 eggs, whole eggs.
Okay.
I have a bowl of berries, which is about 20 grams of carbohydrates, and I have a V8, which is about 10. Okay? Then I don't eat again until about 3:30, 4 o'clock in the morning at the latest. Then I don't eat again until about 5. Most of my day is intermittent fasting. I've done this for years.
Okay.
All right. And at that time, I usually have chicken, fish, meat. I have a large amount of vegetables. It comes in the form of a big salad made from organic lettuces. And that's my day.
Okay.
Usually Friday and Saturday night, my wife and I have what we call a cheat meal, where we eat whatever we want. But the rest of the week is exactly how I've explained it to you. My recommendation is to get on a diet similar to that. Now, if you're on a statin drugs, he's going to keep you on a statin, most likely.
Okay. Yeah, they're saying I need to start them.
Well, the statin drugs, you also know, don't stop the progression of plaque buildup in the arteries. Okay, just basically, anyhow, I won't go any deeper than that. It also increases your blood sugar, which can increase your risk of diabetes. So you need to do what your doctor tells you, but if you can get to the point where everything's more under control, then he can modify the medications, possibly get you off of some of them. Are you on blood pressure drugs too?
No other drugs at all.
Okay, be prepared because they might stick you on that as well. Okay, but what I'm saying, I would probably bring my carbs down. What do you weigh?
179.
How tall are you?
5'11".
Okay, so you're pretty tall. I'd probably go about 60 grams or 70 grams of carbs a day. Okay, and that's going to primarily come from vegetables and a little bit of fruit.
Okay.
Okay, make sure that you take CoQ10 for the heart.
Doing it already.
Okay, how much you taking a day?
It's the liquid form, so whatever the amount is that's on the cup.
Is it sweet tasting?
A little bit, yeah.
Don't take it. Get the pill. Okay, I use Jigsaw because usually as any sweet taste, usually they put some form of sweetener in there.
Okay.
Okay, you don't want that. Okay, so you want to take probably about 400 milligrams a day. CoQ10, when we take statin drugs, it depletes CoQ10. Okay, and CoQ10 helps the heart make energy, literally. Then I would take fish oil. Do you take that?
Yes, I do.
How much you take?
I feel bad. I don't know.
You take that in liquid form too?
No, those are capsules.
Okay, how many capsules a day? Do you know?
It's 2 capsules.
Okay, increase that to 3.
Okay.
Okay, then I would take a B complex.
Okay.
All right, then you want to take curcumin for inflammation.
Okay.
All right, and do that stuff and take your minerals. I would take magnesium. Again, I use
Yep.
Okay, how many milligrams a day?
My wife serves them out to me in the morning.
Ah, okay. All right. Yeah, I take Jigsaw's SRT because it's sustained release. I take all their products. Okay, but try that. But I would cut my carbs. Okay, and that helps to keep the inflammation down. Yeah, and make sure when you have your blood test done, he does what we call an HSCRP. Can you remember that?
I'm writing it down.
Okay, that's an inflammatory marker. That's tied into the cardiovascular system. Okay.
Okay.
All right.
All right.
Okay.
All right. Well, thank you, sir. I appreciate it.
Good luck with that. Good luck with that surgery. All right. They're probably going to put stents in based on what they're telling me. Okay.
Yeah, thank you very much.
Do you exercise?
Yes. Okay. Not a lot, but what I would consider average for my age. Hikes, walks, walk about 12, 13 miles a week.
Okay. Do some weights. All right.
Yes.
See you later. You have a nice weekend. Bye-bye. Good luck.
You too. Thank you.
And, we're talking about the link between all these different diseases and high blood sugar. Okay. And here in diabetes, they're making a lot of money off that. Over $400 million a year, over $400 billion a year for diabetes, more than cancer or heart disease. And they used to link diabetes as being the 7th leading killer. According to this, it says, according to the CDC, the number of people with diabetes has more than tripled in the last couple of decades, reaching over 30 million a year now, 30 million. Researchers have long agreed that diabetes is an underreported cause of death in conditions like like heart disease, blood pressure, obesity, and cancer. Andrew Stokes, assistant professor of global health at Boston University School of Public Health and co-author of the study, said when diabetes and heart disease are both listed on the death certificate, the decision to select diabetes as a leading cause is highly variable. And oftentimes the primary cause is attributed to heart disease instead. So to some extent, deaths that should be attributed to diabetes go to other causes, he said. He goes on to say that overall, Stokes and Preston estimated about 12% of U.S. deaths are actually caused by diabetes, roughly 3 times more than 3.5% death certificates currently suggest. The diabetes death rate was even higher among obese individuals at 19%, according to the study. So they don't give it because there's a lot of money in that. And when you talk about statin drugs increasing blood sugar, people are going to be more hesitant to take them. And they make a lot of money off statins. The key is not to get you off drugs, to get you on more for treatment purposes because they make a lot of money off of our age group. Now, I'm not telling you not to take your medications. I'm telling you if you're healthier, you won't need as much drugs to take for your condition, which saves you money in your pocket. The only one who benefits from you being sick is Big Pharma, baby boomers. Big Pharma, they benefit. You and I don't. That's why they're always coming up with some new Rolls-Royce drug like this Repatha for treating cholesterol because the patents on these cholesterol drugs are running out. We got to have something else we can sell at a high price because they can do a mock-up of the statin drug and sell it cheaper. Let's give you a shot now with Repatha. Oh, my God.